I think sometimes, when you're launching things after you have raised a lot of money, you have new investors, you had put this plan together, there's all this stuff was in your deck that you pitched and you said, this is why we're doing it. You kind of want to give it a little bit more. We definitely threw some good money after bad on that.
CEOs spend their days building their businesses, and strategic questions often get pushed to the nights and weekends when they finally have time and space to think about the bigger picture. I call that CEO pajama time. I'm Sari Kaganoff, the CEO of AITSA, where I work alongside health tech leaders at exactly those moments. Come behind the scenes with me to learn from successful CEOs about the critical decisions and inflection points that shape their companies. Hey everyone, welcome to the CEO Pajama Time podcast. Today I'm excited to host Demetri Karagas, the co-founder of 30 Madison, which was recently acquired by Remedy Meds. Demetri, welcome to the podcast. To start us off, can you kind of take us to the Wayback Machine? I think this was probably 10 years ago, maybe give or take. What was the problem that was keeping you up at night that made you say, wow, we're going to start a company?
Man, has been basically a decade now, which is pretty wild to think about. With 30 Madison, it was actually the second company that Steve, my co-founder, and I started together. And our first company we had sold to a startup that ended up getting acquired by Google. And we were, I guess you could say, hanging out at Google for a little bit, but knew pretty quickly that we wanted to get back in the game, if you will, and do something, but we really didn't know what it was going to be. And for context, our previous company was not in healthcare. We didn't have healthcare experience. We had not operated in that space, and we weren't necessarily set on doing something in healthcare. But what we started to do was just list out a number of different things we were interested in and problems we were having, and just started working on all of them in parallel, right? And that was kind of like the way that we went about saying, like, hey, what's going to get us really excited? And there were a couple of things on that list, and one of them was this idea that started about when you have a particular health issue, it's not that easy to actually get it fixed in the right person, get your questions answered, and then get the treatment all in like a single place, right? And, as we started kind of working on those, what we found over time was like more and more of our time was spent on that idea, which funny enough, we actually called it Project Samson because it was initially this hair idea. We didn't have a name or anything like that. And we saw that that was the one that kept rising to the top of the list. And when we said, what are we going to work on today? Well, let's do more on this one. And as we kind of got deeper, we just said, like, there has to be a better way here, right? Like we had come from kind of the consumer internet, kind of like kind of on demand services and stuff like that. And we said, you can these days, you can click a button on your phone and get a lot of things, but you can't really get a good healthcare experience. And it seems like it doesn't need to be that way. Of course, over time, we realized that there were a lot of reasons why, and there was a lot of difficulties, and healthcare has a lot of things that make it a particularly tricky area to operate. But we just decided we wanted to fix that problem, and that we thought we could be the ones to do it. And then it was actually like March of 2017 when we kind of went and told Google, like, all right, like we're done with our tour here, and that's when we left to kind of go really kind of get things kicking on 30 Madison.
So what made you think that you were the ones? You said we thought we were the ones to do
Yeah,
it. What
yeah.
made you think you were the ones?
What we really gravitated towards was what we viewed as like the, consumer-esque patient experience is so broken in healthcare and still kind of is despite all the, progress that has been made. And we thought that by being outsiders, we could bring a different perspective. And like both of our kind of families are in the medical field and stuff like that. So we kind of had some exposure to it, but by no means were we clinicians or had operated in healthcare. We really brought kind of a consumer mindset to it. But we also kind of knew that we had to really educate ourselves in more of the nuance of healthcare. And so when we first were starting 30 Madison, the first thing that we did was hair loss, right? Which the brand that became Keeps. So we went, we read literal textbooks on like hair loss and dermatology. We got in touch with a lot of the like top experts in the space. And because we said, we know that we bring like the technology and the kind of consumer background, but like we don't bring that. So we need to do two things. One is we need to educate ourselves to the extent possible so no one can question that we haven't really done our homework. And then we needed to bring in folks that could actually bring us, legitimacy there and could actually bring that clinical focus So we spent a lot of time in terms of the early exploration, in terms of meeting the right people, kind of validating the idea and seeing if there was interest there, and then seeing if we could get them involved from the very, very early days so we could make sure that we went in with that clinical focus. But what we really thought was we actually we thought it was a positive, and I still believe it was,
Yeah.
that we actually came in without without knowing all the things that I now know about healthcare that probably would have made me not want to do the idea at the
Yeah.
time. So we went in not jaded or anything like that as we were trying to build the experience.
And did you get pushback from folks, like, when you're trying to raise money or just trying to get started?
We did get a little bit. There were 2 kind of things I would say. One was when we, first had this concept, which now seems pretty commonplace, right, of having the telemedicine and the pharmacy and ongoing care all in the same experience. A lot of the people we talked to early on were like, "Well, you can't do that, right? You can't do that because of, Stark or kickback, the various different rules that exist." And we were like, "That just doesn't seem right. Like, this is, like, clearly will be better for the patient. Like, there must be a
Mhm.
way." Like, that, like, it just didn't make sense at the most basic level. And then the other thing was, it was a little less so on Keeps, although we did get some on Keeps. It was like, "Well, can you really do healthcare via telemedicine? Like, is it actually gonna be
Mhm.
real?" And there were some kind of physicians that we spoke with that pushed back saying like, "Well, you're not gonna be able to give a high quality of care," which was why it was so important that we really kind of educated ourselves on, like, how the diagnostics work within, doing something like hair loss.
Mhm.
We experienced a lot more of this later on, migraine and things like that. And then finding and kind of really spending time with some of the leading experts and them really saying, "No, actually you can, and here's why." And that kind of gave us
Mhm.
the validity. But the biggest things was like, it's not possible. And that's, I mean, frankly, it wasn't really we didn't really face pushback on that when raising money, because the reason why we actually raised our first money was because some of the lawyers we were talking to, like, wouldn't talk to us for free anymore, and they're like, "Look, if you wanna actually do
Oh.
this work, you gotta pay us," right? And then so we raised our seed round, and we're like, "Look, here's why we believe this is a huge problem. Here's why, like, the solution that we know will be really good for patients. There must be a way, but we've been told that it's a little tricky, so we kinda need your money to, like, really kind of
Figure it out. Yeah.
get us to that point where we can actually be confident that we're building a model that can, be built to last, right?"
So, was your initial conception of the idea what it ended up being? I know, like, there's sort of multiple brands, each one with different focus areas. Was that the original idea, or did it morph over time?
Yeah, pretty close, actually, surprisingly so. Like, when I look back at the deck that we used to raise our seed round, which we literally just had a deck, right? There wasn't really a product or anything at that point. And the very last slide in it, we said it was said like Project Samson by 30 Madison on the first page. On the last page, we said like, look, this whole deck has been about hair loss, right? And because we know that space, we are the customers of that space. We spent all this time really learning about the market and the consumer and the clinical side and the treatments, et cetera. But that's really a proof of concept, right? Like, if this
Mhm.
works, we believe that you can build these kind of verticalized solutions at scale, like for many other conditions. We didn't even
Mhm.
venture to say what they would be. We just said like there will be a lot of other things out there that you could build. And so in that case, like, and I was actually talking to someone who helped us like really, really early, and they were like, it's shocking that y'all stayed so close to like what you thought you would, right? I would say the one thing that was, that really probably the biggest things that evolved over time was early on, we were very focused on, like, a single condition, a
Mhm.
brand, and really being the, like, uber specialist in that specific area, which worked for some things, like, for example, migraine and Cove. But we then kind of evolved, particularly after the Neurex acquisition, to say, like, really building for a particular
Consumer.
patient, consumer,
Mhm.
rather than the condition you saw. And as you know, Neurex was like a much broader women's health platform. So, that was a little bit different in terms of like, once you got to a certain scale of a brand, it's hard to build brands, right? Like, we frankly, we probably got a little hubris after the first couple work that we thought, oh man, we can just keep doing this, and it's not always that easy, right? So we decided to really capitalize on the fact that we did have like the brand recognition, the trust there to kind of go more horizontally expand than just kind
Mhm.
of keep doing new brands. That was the
Yeah.
biggest thing I think that evolved from that kind of initial concept.
So tell me about like one of the first like pivot moments that you had or kind of big decision points that you had to make in the early days.
The first one that really came up was, what to own and what to
Mhm.
partner for. And you have to remember that in 2017, now if you want to start a telemedicine company, you can kind of have it up and running in 48 hours, right? You partner with there's all these picks and shovels that have come up, and it's great, right? Because it allows like people to focus on the areas that they really want to innovate in, and kind of makes things a lot more efficient. At the time, none of that existed, right? Because this model didn't exist, right? And, we spent a lot of time, particularly thinking between the medical side and the pharmacy, which were the two kind of core components, like, what to own and what to partner for. Um, and we decided to partner on the pharmacy and own the medical group, obviously through the friendly PC,
Yeah.
but really kind of have more kind of
Yeah.
control there. Um, and the reason was that, that was that initial touch point that the patient had with us, right? That's where we really wanted to show, like, you're coming on your phone to get healthcare, right? Like, and by the way, remember, we weren't synchronous. There would have been things like teledoc and stuff like this. Was like you fill out a form and apparently a doctor is going to give you something that works.
Yeah.
And so we really wanted to make sure that we could control the quality and the clinical experience that people had. And so we kind of went and we had to find a pharmacy that would work for us at the time, but we really had to invest in building the kind of medical infrastructure from day one that could support that. And we wanted to do it in a way that, even down the line, we didn't accept insurance for years, right? But that could put us
Right.
in a place where we could compliantly do that later on. And so that was something that took us some time. We probably could have, launched faster if we didn't do that, but and took some investment. But I think was one of the things that allowed us to kind of separate from some of the others early on in terms of like the kind of clinical quality that we deliver.
Yeah. So how long was it from the time when you started to when you launched?
We formally left Google in March of 2017, and that's when we really got to work. And we saw our first patients through actually a kind of like test brand, not Keeps, but kind of looked kind of like Keeps, but was called something else in like late September, early October of
Okay.
2017. And that's when
So
like the
pretty
first,
fast.
yeah, it was pretty fast, right?
Yeah.
Not as fast as you could do it today, but at the time felt pretty fast. And then the Keeps brand was like fully launched, unveiled in January of 2018. And then that's when we really got focused on scaling.
Yeah. And how did you decide to do asynchronous? Because that's pretty, I mean, it's hard almost to talk about this because the world has evolved so much that it seems a lot of stuff seems normal that back then, didn't exist. But I don't think there was a lot of asynchronous, if
There
any, telemedicine back then.
Yeah, there was very little, right? It was part of that, like, the naive our naive selves coming in to
Yeah.
healthcare, right? The thought just being like, "Hey, like, if you wanna be able to do this, why can't you just, like, fill out form, upload some pictures, do some stuff like that, and then, like, a doctor review
Yeah.
it," right? Like, we didn't even know these concepts, like store and for, these, like, things that exist to make, like, asynchronous and telemedicine doable, and by the way, at the time, it was more limited on the states that allowed it, right? There's
Mhm.
still a couple, but, like, COVID changed that, for the in almost everywhere. It was just that, like, when we initially came up with the idea, before we had looked up at anything in terms of the regulatory nature of this stuff, we just said, "This is how it should be." And then we
Mhm.
kinda went in to say like, "Oh, okay, yeah, like, oh, there's all this other telemedicine that's video, but why would you need to do that? It seems like a waste of time, it's not as efficient, you don't wanna have to talk to someone on something like this,
Yeah.
and quite frankly, you can probably get better data and you're not gonna be distracted or have the doctor like forget to ask something when it's a form, right? And of course, at the time, they were just forms like branching questionnaires. Now you
Yeah.
can do it all like LLM driven and stuff. But at the time,
Right.
it was like a branching questionnaire, but it didn't miss things, right? And so we wanted
Right.
to have really, really complete data on the patient. So and then that would help us over time too, be able to kind of see where they experienced getting the outcome that they wanted or kind of evolve in the clinical journey.
Yeah. Did you get any pushback about the asynchronous nature from folks in the industry?
Yeah, yeah, definitely. I would say especially once we went beyond hair loss and when we launched Cove, which was our migraine
Mm.
business, we actually got a lot. There were even some like kind of like articles written where like people had gone and like found some neurologists that didn't know us or what we were trying to do and said, "Oh, like this is incredibly irresponsible. Like, how can you be doing
Mm.
serious healthcare? Like, you can't. This is like like really bad." And that was quite disappointing to us because we really kind of went. We were deciding where to go beyond hair loss. And look, I get it. It was a new thing people didn't understand and things like that. But our kind of view was always that, you could actually deliver a quality of care on par or in some cases better than I mean, certainly kind of synchronous medicine, but even brick and mortar because you get you get all the information, right? You're able to get
Yep.
all of it. You're able to kind of see this in a way that then you can then train kind of, the providers and the models and stuff to do this more effectively. And, by the way, later on, we actually published data on Cove that showed that our outcomes were superior to
Yeah.
even a lot of brick and mortar clinics. But yeah, there was a lot of pushback, which is another reason why, we from the very beginning, it was very important to us to find the best doctors in the space, the best specialists. Like, we worked early on with like Dr. Alex Malscott, New York Headache Clinic, one of the leaders in the whole country on this, and saying, you know, we want to make sure that like you feel like this is good medicine,
Yeah.
right? Because if you do, then when someone else who really isn't as big of an expert comes and says, well, this isn't real medicine, I can say, well, why are you saying that, right? Like let's see what
Yeah.
we actually do. Let's see about the quality. Go through the patient experience and see it. But yeah, it was we definitely did early on. There was a lot of kind of skepticism, I would say, both from the kind of you know call it the like startup tech press and stuff, and also from some of
Yeah.
these clinicians, uh, um, which is kind of funny now, right? When you think about how ubiquitous this
Yeah,
kind of
for sure.
healthcare is today.
So what made you do migraine next? Or I don't know if it was next, but soon thereafter. Because hair and migraine are very different.
They are, yeah, and that was another like as Steve and I were thinking about where to take the company after, Keeps was scaling nicely. And, just like everything that happens in a startup world, there's always like multiple companies doing the same thing at once, right? It's this bizarre thing. Every company I've started was like three people and they all launch within a month of each other, just like completely. It's like the way the universe works, right? And, so like there were us, Hims and Row. We kind of did hair. Row had done ED. Hims had
Uh-huh.
kind of done a little of both. And when we were talking to investors, Keeps was growing really, really well. Hims had just raised some money. People said, well, they raised money. How are you going to like be able to compete? Our thought was, well, first of all, like we know our numbers are really good and we know there, but there was always like, well, what's next? What's next? And what we wanted to show, and kind of like I said at the beginning, our initial vision was not that we were building a hair loss company. It was, and that's why the company wasn't
Mm-hmm.
called Keeps. It was called 30 Madison, right? It was that we wanted to build a healthcare company that could go beyond that. So we really said, like, we need to go the absolute other end of the spectrum, right? Like, what is something that we know is a big problem and that we believe the model can work really well on, but would be considered, particularly as we started getting more into like the healthcare ecosystem, quote, real healthcare, right? And so we had a couple of candidates, like we looked at some GI things. So we actually did some stuff in GI,
Mm-hmm.
but migraine was one that really fit, right? And the other thing that was
Mm-hmm.
interesting there is that unlike hair loss and ED and these kind of categories where most people were coming in were kind of like what we call like treatment naive, right? They had never treated their
Yeah.
condition before, but they knew they had a problem or they thought they had a problem or they learned they have a problem and they want to do it. Most people with migraine, I mean, they know they have migraine, obviously, right? And they
Yeah.
typically tried to treat it for some time, sometimes even going to neurologists and stuff like that. So people were coming in really looking for something that would finally work, right?
Yes.
And so we said, if we can prove that this works here, um, we can kind of do anything, right? And we did. There were a lot of firsts. Now it's another kind of like thing to look back and like, especially with the rise of GLP-1 and all this stuff. But Cove was actually the first company to do a kind of like injectable biologic, which the
Yeah.
anti-CGRPs through asynchronous telemedicine, right?
Mm-hmm.
Uh, and then that of course has become incredibly ubiquitous with the rise of
Yeah.
GLP-1s. But But yeah, so that's why, and we got a lot of that question, particularly from investors, like, what in the world,
It's a
migraine?
bit
Like,
random. Yeah.
people even have migraine, and a lot of people do, and people don't realize, right? Um, and it was never gonna have it, that same trajectory of something like hair loss, just because of, like, obviously you
Right.
have half the population versus, like, say, like, 20 million people or so. But it remained even to the very end. Um, you know, it became sizable for migraine. It was a large provider of migraine care in the country, but in terms of 30 Madison, it was smaller. But it was always something that we kind of continued to fine tune and test new ways of kind of this more complex medicine that we were then able
Yeah.
to deploy across other parts of the platform. Just because we knew if it worked there, it would work really well, for,
Right.
say, hair loss or birth control or derm or whatever.
So walk me through the decision process though. You tested a bunch, like how many candidates did you have? How did you test them? Like what was the process there?
Yeah, so we had maybe 3 to 5, like, areas where,
Mm.
and some of it was kind of like, we kinda looked at population sets for different conditions, and then we did do early on, this is something I think we did not as well later on, but early on, we were really good at doing a lot of early, like, demand testing and conversion testing, saying, like, "Is there something here?" Right? And migraine really seemed to resonate with, you know, the population that we were going out to, because I think there is such a shortage. Because the other thing that we did, and we actually used this later on as well, we saw that, there's 20, 30 million people that suffer from migraine, and there's only 500 headache specialists in the whole country, right?
Right.
So just by that nature, there is no way that most people are actually getting the quality of care that they're
Yeah.
seeking. So there's an absolute need here, and that got us really excited about it. And it was also one that the other thing that was interesting with it that we kind of used and we used later on as well, so we were kind of building the criteria set, is this: there were new treatments coming out, right? The
Mhm.
anti-CGRP at the time, Amavig, Ubrelvy, these, and then, obviously Nurtec later. So these coming out, we thought this could be really interesting. And, another kind of funny thing looking back is we really tried to work with some of these pharma companies in the way that the companies are now working with everyone on GLP-1, but
Yeah.
it didn't work. Everyone was like, "Well, no, we can't do that. We got to go through PPM. Like, how can we do this sort of
Mhm.
thing?" So, you know, once, when you have things like NovoCare, Lilly Direct, all these things that are doing really well, that
Yeah.
I think they're great for patients, they're great for the platforms, they're great for the pharma companies, etc. At the time, it took something as, monumental as GLP-1 to make people realize this could work, 'cause, like,
Yeah.
that did not work for us, with migraine, even though there were these new kind of treatments that were pretty transformational.
Yeah, and I do think maybe there's something about like what you were saying where, three companies started the same thing at once. It's like there's a certain market moment where something comes ripe and just makes sense. And
Yeah,
probably it was just too early. You did have the partnership with Nurtec though, right? In
we
the early
did.
days.
We did, yeah, yeah, and Nurtec, part of, them, obviously they sold to, Pfizer later, but Biohaven, the
Pfizer, yeah.
company that created Nurtec, was, nimble, like, innovative thinking. They wanted to do something different in the marketing side, and for us, we were like, "This is this incredible new treatment." Like, we're seeing the data, and it's like, I mean, it was literally, not exaggerating, life-changing for a lot of patients that were able to use it. And so we wanted a way to offer that to our patients. They were looking at a way to kind of get that out there and compete with these huge, massive, Amgen companies coming out with things.
Yeah.
And so, yeah, so we kind of had a thing where, we kind of did some kind of co-marketing and things like that.
So tell me what was the hardest part like in those let's say first 8 years or so? What was like some of the things where you're like, wow, we totally screwed this up, or what was a challenge you had?
Yeah, I mean, well, I think this is only an hour podcast, so we could go on for a long time with that. But look, I would say, one thing was, for us and for others in our space, COVID, when it hit, was this absolute tsunami shockwave, like, change the business overnight situation, right?
Mhm.
And, for us, we had just kind of, in a weird twist of fate, we had just done our Series B. We actually closed it on March 11th, which was like the day
Oh,
I
wow.
believe that like the NBA canceled those games, the president closed the airspace, and they're like, there's this thing COVID here, right? Dow dropped like 1,000 points. I was like, please, everyone wire the money, right? Everyone except one person did. And we had that, and we had our first board meeting with our new investors on like March 13th, Friday the 13th. And we're like, well, we have these forecasts, but we're like ripping them all up. We have no idea. No one knew. And now it's so obvious that it was this huge positive thing for telemedicine. By the time that you just didn't know, right? But pretty soon, within, 5, 6 days after that, we just saw like CACs dropped to like levels we never thought would have been possible, right? Because, if you weren't doing like telemedicine or standing desk, like you stopped advertising, right? So,
Hmm.
and also it now became a necessity, right? Like you want to go see a doctor, you got to use telemedicine, right? So we were fortunate that we had kind of like a restocked balance sheet, right? But
Yep.
we then the business just went on complete, it started growing so fast, right? So what was really strained the business, to be honest, was it was this period of time where we were going through this incredible hyper growth while also figuring out like how in the world are we going to like work when we can't go into the office and stuff like that, right? And so, every company had to go through this process of like figuring out how to do remote, but we were also doing it when we were like far understaffed, like adding like 20, 30 new people a week, just like this sort of like insane thing. Looking back like on some of the some of the brand expansion that we did, I mentioned some of the testing and the way that we operated early on, like we were deciding to do Cove and things like that. As we kind of like got bigger and we tried to kind of like do things, we kind of lost a little bit of the rigor there, right? And
Hmm.
I think we got a little overconfident that like the first couple brands had worked, right? And so like, oh, we can just keep doing this, right? And so we had a couple that didn't work as well, right? And then we had to kind of like spend a lot of money and time on like brands that ended up we probably should have never launched, right?
Was it that the first few you had a process you were following and then you sort of didn't follow that process? Or was it more like lucky accident? Like what the first few, like what do you think
I think it was
happened?
both. We were very rigorous and we did a lot of work to really ensure that we were super confident about hair loss, that we really want to do migraine, these sorts of things. But we probably could have gotten confident on a different category for the first one, and it would like it was a little bit of right time, right place, right? Like things like where there's always luck involved when that first thing works well, right? I believe at least. But it was also something where we had done a lot of the homework, and later on, I think we, you know, things kind of as you grow, sometimes you know, myself, Steve, we're probably not as close to some of the things later on, just as things were going. And we lost a little bit of the rigor with kind of launches in that kind of hyper growth phase, particularly after we did our like Series C and stuff. Um, and then we got that back later on, but there was a kind of period there where I think it was both, to be honest with you.
So walk me through what happens. Like you're looking at board meeting numbers and suddenly you're realizing like what made you be like, "Ooh, something's off here. This isn't just like slow. This is something's wrong."
Probably took longer than it should have on certain of them, but I mean, you usually you usually know, right? Yeah, you're in the board, you're looking at the metrics, and there's not like, what's that phrase? Like lightning in a bottle, right? It's just not there. And obviously, building a business is really hard, but like if you're doing a bunch of stuff and no one cares, and like you're changing these things and it's still not working, then you really need to ask yourself, like, is this the right thing or should we just shut this down? I think sometimes, when you're launching things after you have raised a lot of money, you have new investors, you had put this plan together, there's all this stuff was in your deck that you pitched and you said, this is why we're doing it. You kind of want to give it a little bit more. Man, we invested all this money in the brand. And yeah, I mean, we definitely threw some good money after bad on that. Because looking back, I think, you know, uh, something I tell founders all the time is like, you really got to trust your gut, right? Like it's usually right. Even sometimes you may be hearing advice from I don't know, some of your executives or the board or whatever, but no one's gonna have that, like, weird, deep connection to, like, the business as you, and I do think that, like, looking back, like, some of the, best decisions we made were, maybe even when, like, our investors or whatever were kind of opposed to something, but we just trusted the gut and went with it, and the vice versa is true also, right? Like, even that
Yeah.
story I mentioned about, like, after COVID, when COVID happened where, the spin, like, we kind of aligned at that board meeting, like, be very judicious on spend, like, don't, because you don't know what's gonna happen in the future, COVID's this how long is this thing gonna be here? But as soon as we saw the CACs, I mean, we told the marketing team, we said, like, "You would have no budget, just go," right? And
Mhm.
that ended up being absolutely the right call. We had to kind of explain that and stuff like that, afterwards. With some of the kind of brands that didn't work out, I think it was more of like, oh, just really trying to push to make it work, but, uh, they weren't going to, you know?
Do you think that there's an element of where in the beginning you're so in it, you're testing, you're learning, you're like pivoting very quickly, but then once you're a bit later, you mentioned like you've raised more money, you're also not as involved in the business, then you start to almost like shift gears and run it more like a quote unquote business instead of a startup. And then you're like, oh, this is what we're doing because we had a plan. Where like in the beginning, you might have had a plan and may have lasted a day. Like you just change it,
Yeah, yeah, totally, totally, and I think, like, another, like, thing that really, like, you when companies scale, especially when they're going through this kinda hyper scaling, you often, like, you get a little removed from the business, right? And you delegate more and things like that, and you're told this is what you're supposed to do as you scale and stuff like that. But it makes it harder to really kind of have that pulse on what's actually happening. Like, are you still as close to the customer? Are you still this? And then I think what happens when I think things end up going well in the end is like you have that realization, right? And you're like, wait a second, right? And then you have to course correct, right? Because I think, and I think one of the things that's kind of exciting about this world of with AI and like the new tools that you can use is like you can create something in a way where you can stay close to the ground level even as things scale, right? And even as things scale, because maybe you can scale where you don't have to you know, bloat the team as much as like, a lot of us did in that 2020, 2021, 2022 days, right? And then as a result, you as a founder can stay a lot closer for a lot longer, or preferably forever, right? In terms of like
Yeah.
what is actually happening, because I mean that definitely happened at 30 Madison, where I felt like we got a little further away, and I was getting reports on things, but I didn't actually maybe know to the extent that I should have, like, what was happening in the trenches. Some of those things that worked when you were smaller, I used to think like, well, there's things that work when you're smaller, they won't work at this stage and that stage. But there are certain things that worked when you were smaller that like are the reason you got medium. You have to figure out how to make that those
Yeah.
unique things about your operating model
Yeah.
scale, right? And that's hard, right? And that's where like some of these things where like the founder does need to get closer. The founder does need to like listen to their gut and like maybe sometimes they say, well, why are you micromanaging me or whatever? Well, maybe you need to in certain
Yeah.
cases, right?
So
And
what
so
would you say if somebody were to ask you like, okay, your secret sauce operating model, like what are the like handful of things that you feel like you do really well?
there's kind of like three kind of like there's kind of like these guiding principles of like having to really stay close to the customer, right? Like, always have to, like, do that, like, really doing that and making sure that you and everyone on your leadership team, everyone is doing that, right? Because otherwise, like, how are you supposed to make decisions, right? Like, how are you supposed to so staying, like and that doesn't mean, like, you know, reading some synthesized feedback and stuff like that. It means, like, actually staying, like, really close to the customer themselves. I think, like, as we kind of went back and forth over things at 30 Mass, and it's like those areas that you get the most energy from, right? Like, as the founder, like, just keep those for yourself, right? And like, even if it's like, wait, why is like the CEO or whatever like doing this work? Well, if that's where you get the energy from, that's probably like what makes what you're really, really good at and that you're gonna get most passionate on. You're gonna be able to push like more than anyone else. And like that, like those are great examples for the organization, right? Because they kind of see that. They also see like, whatever level you are in the like organization, like you're like there, like kind of in the trenches doing that. And it can be anywhere with it can be anything, right? Everyone has different things. Maybe it's people in product or marketing, brand, whatever, right? Like whatever it is, like, those areas, like don't delegate those, right? Like don't
Mhm.
delegate that stuff and actually like be there in the trenches. And then the third one is really just like, again, that like trusting your gut and making those decisions, even if it's like there are certain times where like, look, you have to be a data driven person, stuff like that. But like there are certain times where often when it comes up to like the CEO, the founder, the reason the decision is getting to you is because there is not complete information, right? And there is not, and there is some ambiguity and there needs to be this judgment, right? So like, you know, listen to your advisors, your board, whatever, but um make the decision that you feel is right. And I think when you look back over the course of years of a company, you'll see that like often when you did that, even if it went, opposing to what the maybe like conventional wisdom said, it was probably right more often than not.
So let's dive into some of the M&A question because you've been on both sides of this table, right? You bought Nurex.
Yeah.
Is that the only acquisition that you made at 30 Madison?
The other
Or
one
you
was
had
the Pill Club. We bought the Pill Club too.
right.
Yeah.
Okay,
Yeah.
that's true. So Nurex and Pill Club, and then eventually you sold to Remedy Meds. And so walk me through some of the decision making process. Like, why did you buy Nurex? Was that a plan? Was that like opportunistically you saw it was available? Like, what happened there? Why did you decide to do that instead of building everything organically?
Yeah. So we had, kind of mid 21, late 21 that we first started speaking to them. And it was kind of a opportunistic kind of like introduction, right? Like, so an investor we had spoken to like in a previous round who ended up not investing in us, like called us and they were investing in Nurex. Oh, y'all should talk. And we started chatting. We had been really interested in women's health for some time, particularly after COVID, because, COVID, like 95% of the patients were women. We saw there's this really interesting thing here. We want to be able to do more here. How could we do it, right? I think we also saw that as the markets were evolving after the kind of like, the high everyone was on after the COVID boom, it was kind of like, what's next, right? Like, okay, we just raised all this money. How do we keep up the growth rates that we need to do? Like, what are we, like, how should we think about that? And that's what kind of got us to think, yeah, maybe we should take this conversation, right?
Mhm.
But we didn't at that time. We did not think we would be this like acquisitive, like do M&A. It had not been on like the pitch in the Series C or anything like that. But as we kind of got to meet the team there and just started thinking about like what it could be like if we brought these two companies together, and we saw like, wow, if we took some of the like strengths that they had in insurance, the strengths we had, and some of the kind of like operational efficiency and things like that, it could like leapfrog us to the next stage, right? And when you start
Yeah.
getting to like, bigger numbers and you have, we had this big brand Keeps, we had, Cove, we're trying to do some of these other ones, we realized like it's gonna be really hard to get another breakout like Keeps. Like we started having that
Yeah.
realization after some of those brands. But here, if we could actually get this thing that's already at this size growing and we put some of what we believe, and by the way, anytime you're doing a
Yeah.
deal, it's always because you believe you can do it better, right? Like, why would you do a deal
Yeah.
otherwise, right? Sometimes that's true. Sometimes it's never all the stuff is true, right? And then that's kind of like when we started thinking really seriously about it. But it took a couple cycles. We thought about it for a while and it not happening. And then we kind of got back together and then we ended up kind of doing it, signed that LOI actually in between Christmas and New Year's of 2021. I was locked in my room with the
Always
Delta.
happens like that
Yeah, yeah,
somehow.
with the Delta virus.
Oh,
Steve and I both had it. We were both like locked in our rooms quarantining. But hey, lots of time to review documents, right? So yeah, but it always happens like that. And then we closed that deal in March, and then after that one is when we really started thinking more about. And look, don't get me wrong, like integrations are painful, like very, this, right? You've helped a lot, like they're really tough. Uh, they take tolls on organizations, but if you get through them to the other side, like it can be really powerful, right? And then that's when we started thinking about like, should this become, should we make sure this is a competency of the company, and are there other things that we can do? So that's why when the Pill Club came about, we were able to move really quickly on it.
And so you think it was worth it despite the pain of integration? It was a worthwhile
I
move.
mean, for sure. Like, look, by the end, like Nurex was bigger than Keeps, right? So I mean, just like
Mhm.
mathematically, like when you think about like,
Yeah.
it was an accretive deal for sure, right?
Mhm.
Um, and I don't think we would have gotten to like this more diversified platform that we became that ended up being really interesting to a company like Remedy if we wouldn't have done that, right?
Yeah.
Um, um, so yeah, look, I think that if I think M&A for startups, like growth stage startups, can be very, very powerful as like a strategy, but you just have to kind of go in eyes wide open, right? And,
Mhm.
you know, everything will take longer than you think.
Yeah.
Everything will be harder than you think. So you have to make sure, for example, that you do the hard things, right? Like make sure that
Mhm.
if you put some like cost synergies in there in the model, like you better hit those. Like you have to hit those because like the revenue synergies are probably going to take longer and they're not going to be a thing or
Yeah.
they're going to happen, but they're going to happen in 18 months instead of 7 that you put in the model, right? So the cost synergies you can control. So you have to do those. Often, oh man, but that's going to hurt this or that. But like, you got to be able to hit those because
Mhm.
there is going to be churn. There's going to be this sort of stuff. And you also have to realize that like some of the other things that are happening in your company are not going to work as smoothly because your attention will be diverted, right?
Right.
Um, and look, we learned a lot from Nurex. So when we did like Pill Club, it was much easier, right? Like it was a different sort of thing. We bought out of bankruptcy and stuff like that. But like, um,
Mhm.
we just went in a lot more like clear-eyed, saying like, this is gonna be difficult, right? Everyone like be ready. It's gonna be some hard
Yeah.
days, weeks, months, but like, here's why we're doing it. Here's what we want to achieve. And like, we just went in there with Nurex. We kind of went in and we you know trial by fire on a few things.
Yeah. For sure. So then when it came time for the exit, why'd you choose to exit when you did, through M&A? I mean, obviously the IPO markets haven't been great, so maybe that's part of it, but kind of curious, like, why'd you
Yeah,
decide it was the time?
yeah. It kind of was like January 25. Kind of made a decision like we need to do something, right? Like, at that point we had kind of gotten to profitability, not huge amounts of profitability, but basically like break even to marginally profitable, few $100 million in revenue, but we weren't big enough to consider like an IPO, right? Because, in the consumer world, you need to be like bigger than that. And to just grow organically to the point of where I believe it's like closer to a billion in top line to be like really seriously think about it as like a consumer digital health, it would just take too long. So then it was like, okay, so what do we do, right? We could buy someone, we could merge, we could sell. Like I was kind of like indifferent between those. It's like whatever we found that made sense, right? And we actually got pretty close on one where we would have been like the acquiring party and paired that with a fundraise and gone, and that was interesting, but, really wanted to see everything that could be out there, and it happens in weird ways, right? You never know how you're gonna Remedy Meds, to be honest, they weren't even on my radar of, like, potential people we would do a deal with. I was aware of them, but not like I didn't think they would, necessarily wanna do something. But it was like one of their investors was at an event and met Caroline, our chief business officer, was like, "Can you introduce me to Demetri that he has?" And she said, "Okay, yeah." And then that led to one thing or another. And then, kind of in the middle of the year, I kind of made the decision. I think this is the one that makes sense. There were a couple others that we were looking at, but this one kind of made sense from, obviously a value perspective, financial perspective, a go forward strategic perspective, all of the different pieces. And that's when we decided an exit in terms of like selling the company to them was probably what made the most sense for the company. And then it was just about actually getting it done.
Is it so like any, I don't want to say regrets, but any sort of bittersweet moments, like as you let go of the thing that you built for like a decade?
I think that not really because I like felt really good, like about Horace and like who, like, particularly into, I mean, obviously the team he's put together, but like really that like he has a vision of what he wants to build and it aligned with where I thought 30 Madison, because, I think, we're very proud of everything we built at Thirty Madison, the impact we had on the space. But uh, you know, it's still the beginning in terms of what like digital health can do, I think, for healthcare more broadly. And I was like, this is the right team that can help that vision be something, make Keeps in the brand it can be, Nurex the brand it can be,
Yeah.
and et cetera. So, um, it felt as a result, it felt like the right time,
Yeah.
and it's a bit of a bizarre feeling the day that like, especially once I like finally wrapped with integration and stuff like that, and it was kind of like my you know email and Slack turned off, and I was just like, whoa, like like that's this kind of almost surreal thing. But no, I wouldn't say regrets. I mean, look, when you look back over the course of the entire thing of building a company, there are of course things you're like, oh, we could have done this, we could have done that. But in the moment, I think we did what we thought was always the best for the company at the time. And if anything, you take all of that into whatever you do next. Like when we started this company, when we'd done a startup before, but we sold it very early and stuff like that. And talked to a lot of investors when we were starting Third Madison. We were like, oh, you guys are second time founders like this. And looking back, I'm like, wow, technically that was true. But actually, like, compare, like now when I look back at myself when I was starting the company, I'm like, I knew nothing,
Yeah.
So, the experience and I think like just like reps of having to make judgment calls and stuff like that you build over, you know, this time period is, it's almost hard to think about, like, what that kinda means for
Yeah.
you may wanna do next, right?
So we're running short on time. I'm going to try to squeeze two more questions in. So
Yes.
hopefully we can hit this quickly. The first one is you had a co-founder throughout this and you worked with him before. So I guess you work well together. And you said we this whole time. I'm curious, any tips for folks as they're thinking about working with a co-founder or choosing a co-founder, or like what made it work well, and anything that we can learn from that?
Yeah, look, I think so Steve and I have worked together now for almost 15 years, right? So yeah, it's something, and I think, we plan to work together on things in the future as well, and I think that the
Yeah.
big thing is just you have to like you're going to have disagreements throughout the years, right? So like you just have to have like a very clear like way, like how do you want to like, and it will be different for whoever you are and who your partner is, but like how do you work through those like differences, right? And how do you have this like guiding like North Star that we it doesn't like one thing that we always said was it doesn't matter, like I could care less whether it ends up being my idea or like, there could be a 6 month streak where like it's all Steve's ideas that were the ones that were good and mine all sucked. And then it could be a year that it's revert, you don't know, right?
Yeah.
But it's like, because it's a long game building a company, because you just learn how to resolve your when you have disagreements. And you also learn to trust, like there's certain things that like I just can defer to completely Steve on. There are certain things that he does the same for me. And that's just something that takes over time. So you can commit to like working through and like, what is your conflict resolution? And you trust that like, we're just here because we're trying to build the best company, right? That's what we're trying to do. Nothing else matters. I think then you kind of, over time, you just build like a certain level of trust.
That makes sense. All right, last question. Myth busting. What do people tell CEOs that you're like, not that?
I think the biggest thing, I would say, kind of goes to this like a little bit of like trust your gut, right? Even if you have like executives, they're supposed to be experts in certain areas, or boards that are supposed to do this. Like I would say no, right? Like it's really
Okay.
like you can do that. It's totally fine to, I mean, obviously, like don't do something that you don't tell. You have to tell your board about certain things or
Yeah.
whatever. But you make that call and do it, because you will probably be right more likely than not. Maybe not every time, but over the long run. And what matters in the
Yeah.
company is like good decisions, more good decisions than bad ones over a long run.
Awesome. Well, thank you so much for sharing your insights over this journey with us.
Absolutely. No, thanks for having me.